Few words from my point of view, first of all, about the London Health Commission. And I'm very grateful to you all for giving up your time this afternoon to come along and support this. Something I think is very important. London is, of course, as we all know, a world-class city. But in terms of what we do for the population, its patients, in terms of the health outcomes, we're not nearly as good as we could be or we should be. And really that's a travesty for a city that really has the wealth that we have. And so we've tried numerous times over the years with numerous strategies to try and improve that situation with varying degrees of success. But what I would like to emphasize is with the impetus and the political backing of the Mayor and the Mayor's office, we really do have an opportunity here to build on something very important. Because although, as I say, we've had strategies in the past and they've been variably effective, this is an opportunity to reach out much, much wider than we have done before, to people like yourselves in education, to those in business, to those in academia. And I think it really does represent an opportunity to put London's population and the health services in London, but also the outcomes for London's patients and its population really in that Premier League. And that's what we're aiming for. So today, what's this afternoon going to be about? Well, it's really an opportunity to engage. It's an opportunity to listen to what you have to say, what we can take on board as those responsible for changing services, what you feel about them, and how you have the opportunity to do something that's different that will secure London's future as a Premier League team, which is the way I like to view it. We've had numerous submissions from several, first of all, written submissions, well over 200, and some of you will have contributed already, which have been very, very useful and interesting. But what has been perhaps most fascinating are some of these events that we've held already, which are the oral hearings, because this is really the opportunity for you to say it as you see it and as you would like it to be. So, great opportunity. And the sort of construct of the afternoon is going to be some panel sessions, and I'll be introducing, after our presentation, which I'm really looking forward to seeing, by the way, I'll be introducing our panel members and also our panel guests, but I hope this actually becomes very much a dialogue between yourselves and ourselves, because we are here to listen and to hear what you have to say. So that's the content of the afternoon. I'll come back to the presentation we're going to see in a minute. Just a word of thanks, really, to our guests for the afternoon, to the Academy, which it's fascinating for me, actually, as a paediatrician coming back into a school environment. I do visit schools, but there does seem to be something special about this place, and I understand it does have quite a unique offering. And what I'd be very interested to hear is what you, who work in this great academy, feel you can do for the young people, in the future. This afternoon's topics are, of course, going to be about children and young people, such as yourselves. And we do need to hear what your voice is as well, but what we can do to secure your future. So the fact that we're talking about children and young people is also very, very important. But also the concept of integrated care and how we build services around patients. So thank you very much to the Academy for hosting it. Thank you also to Saving London's Lives, because this is a fantastic collaborative initiative. At this stage, I think I'd like to move us on to the panel discussion. So perhaps I could ask my panel members to come up and join me. And we'll go through a round of brief introductions. While people are finding their seats, the first session that we're dealing with today is around children and young people. I'm a practicing paediatrician myself, and so I'm absolutely delighted that children should have the degree of priority that the Health Commission is offering, because far too often the needs of children and young people are overlooked. There are thought to be many, many more things which are of higher priority in our agendas. So to have the opportunity to have this length of time to debate children's issues, to my mind, is very important. And of course, we do have problems. We at London is becoming known as the obesity capital of Europe. And that has long-term implications, and I'm going to be interested when we get round to the discussion to hear from the panel about what we can do to correct that. We know as well that we've got young people who, 1 in 10 of our young people, I've heard from Kat, who's a panel member recently, does not feel that they're able to cope with life. So we have a rising problem with mental health issues in young people and with substance misuse. So there's a whole range of problems, and the harsh reality is that with data that was revealed just last weekend, that children and young people die at a greater rate, a greater frequency than at an early age than other parts of Europe, and that's a travesty. So quite a lot to debate. What can we do to improve it? And I'm going to start. I would like to start, I think, just by asking my colleagues here to introduce themselves. I've introduced myself already. I'm going to start with Kaz to my left. If you can say who you are and your brief background, Kaz.
So my name is Dr. Kaz Sayer. I'm a GP. I've been a GP for 25 years, and I'm also chair of one of these new clinical commissioning groups that's responsible for commissioning services for local populations across hospital services and community services.
My name's Chris Strether. I used to be a kidney doctor, and I now run a network which is trying to join together health and social care systems across the whole of South London.
And if I can move to Nick.
I'm Nick Rainsford. I'm a Member of Parliament for Greenwich and Woolwich. I have no particular expertise in health, but obviously health is vitally important to all the people who live in the area I represent, and that's why I'm very pleased to be part of this commission.
Matthew?
My name's Matthew Patrick. I'm a psychiatrist by background. I am the chief executive of a large mental health trust in South London, and I also indeed work for Andy, chairing London's mental health strategic clinical network.
So we're the panel members. I think as the conversation goes on, you'll hardly be able to draw the distinction between the panel members and our guests, but perhaps our guests could introduce themselves as well. If I could start with you, Melian.
My name is Melian Mansfield, and I'm chair of an organisation called, I'm chair of an organisation called the Campaign for State Education, but I'm here as chair of London Play, which campaigns for play across opportunities across London for children and young people.
Good afternoon, I'm Dr Maggie Atkinson. I'm not a medical doctor, I'm a doctor of education, and this afternoon's worst advert for health. I've got a dreadful chest infection, so I apologise for that. I'm Children's Commissioner for England, and that means that I'm here to promote and protect the rights of the child, very particularly the most vulnerable, the least heard and the most marginalised, against the United Nations Convention on the Rights of the Child, some of which is about your right to health and to services that respond to your needs. I'm just looking at the under 18s in the room here.
Yeah.
Martin Dudley, I'm an elected councillor for the City of London Corporation, where, until tomorrow anyway, I chair Community and Children's Services, but also chair the Health and Wellbeing Board.
My name's Catherine Cormack. I'm here with a number of hats. I work for NHS England running a mental health app for young people, but I'm also a mental health service user myself.
I'm John Morgan. I'm Head of Outdoor Education here at St Matthew Academy, and I also run the Emergency Life Saving Programme here at the school. When I'm not here, I'm actually a medic with the Army Reserve, and before that I was actually a medic in the Army from the age of 16. And I also work for the NHS as a first responder. Thank you.
My name is Mary Smith, and I'm the project manager for Saving Londoners' Lives. As you've already heard, we enable London schools across all boroughs to teach emergency life support skills every year at no cost to the school.
Okay, I'm Ben Smith. I'm an educator at St Matthew Academy. I'm here because healthy children learn better and get better grades and go on to do better. I've also got an interest in access to medicine for younger kids. The pupils that you saw today, they're all part of a programme called Growing Doctors, which has been running for the last 4 or 5 years.
Good. So thank you very much. And can I just say to everybody in the audience there, if you've got a pressing point that you feel you'd like to make or a comment, just put your hand up and we'll try and incorporate you into this discussion as well as we possibly can. But you'll have to give me some leeway because this may be quite difficult to chair as we go along. But what I would like is to have an open discussion as much as possible. And I think to start, Ben, I'd like to turn to you. First of all, thank you again for hosting us this afternoon. This is the first time I've heard about the Academy, but clearly, as I said at the beginning, it does have a unique educational offering. But what I suppose I'd like to tease out with you in terms of the future health of young people, children and young people, is crucial to the future of London. And what is it that you feel you have to offer? What initiatives, over and above the one that we've seen here already, that you think is really going to make an impact? So what is it that schools should be doing to really raise the agenda of, I suppose, awareness of healthier lifestyles in children?
I think there's a couple of points that you can draw from that. I mean, we can take students and try and encourage them to become part of the healthcare system, in which case they should be promoting health anyway, which is what we're trying to do with the Growing Doctors project. We also need to think about how we can integrate healthy eating into a curriculum a bit more deeply.
Okay. So in terms of the Growing Doctors issue, I was quite intrigued by that, because you're actually presumably encouraging people, youngsters, to think about medicine as a career, but you're also be encouraging them to think about wider health issues anyway. How is that running, and how are you taking that forward in the school?
Well, the Growing Doctors project's been going for 5 years now. I started it up in collaboration with Dr. Danny Reuter, who's social health in Lewisham. We sort of believed that the best people to be getting social health out to the local communities are people from the local communities. We set out with the hope that we can take Lewisham children and build them to become healthcare professionals for Lewisham. They understand the area, they'll develop the area, they want to support their own people. So that's really where we started, and the idea behind it was to form as many links as we could with as many organisations that are about getting children into medical schools, such as King's College, the Extended Medical Programme, the Welcome Collection, for example, and create a curriculum that would support them from year 7 all the way up through to the interview, essentially, for medical school. It was not just looking at academic sides, it was looking at the wider skills required to become a doctor. So it's looking at ethics. We were looking very much at caring profession, expanding their horizons, maybe giving them access to culture that they wouldn't necessarily have access to support them with their application to medical school.
But presumably you're extending this curriculum to beyond those who just want to do medicine, because you're talking really about health advocacy, aren't you, for young people, and acting as health supporters in a way.
I was actually thinking about that earlier, and the idea of what schools could be doing is training up local, almost student ambassadors for health, students that would become role models to the local population, because social media in particular, the celebrities of today are local people that have just got a following in their local area on social media, and it's just ballooned to become very influential. They become very influential people. If you can get students within local communities to take on a positive health role, students will follow, as long as it's seen as the cool thing to do. There's been a huge amount of change in education. It is changing quite quickly. One of the changes has been to become more academic. Vocational education it's in flux. It's not clear which students it's now accessible to, and I think we are missing out in education on some of those paraprofessional roles, how we could actually train them up through vocational education, which would be clearer at this sort of earlier stage, so Key Stage 4 instead of Key Stage 5.
So can I ask some of your pupils who are sitting here doing the dummies, how many of them are thinking of some form of role as a health professional, if any?
Either doctors, nurses, anything. Quite a fair percentage.
Can you identify what sort of roles you were interested in?
I've recently wanted to study politics. At home, I read a lot of books on like the body and how it works and stuff like that. And plus, my mum is studying to be a nurse as well, so that kind of influenced my decision as well.
I would like to become a surgeon, as I work well with fingers and I enjoy organs, living things inside the body, and I'm interested in like just searching through people's body, kind of, but not just like yeah, pretty much that.
I was interested in being a midwife and being able to help people give birth.
I recently took interest in being a neurologist because I've always had an interest in like the human brain.
I have an interest in becoming a paediatrician.
Very good, thanks. And Ben, I mean, you may know him as Mr. Smith, but Ben said that he also wants to create an awareness of health issues in the Lewisham and community. Is that something that you feel as well? Do you feel collectively that that's what you'd like to do to contribute to the better health of Lewisham people? Very good.
You are citizens now. I'm just because I'm Children's Commissioner, I'm going to ignore the adults. You are citizens now. You are London's future, but you are also London's present. And in some London boroughs, you are 1 in 3 of the population or close to it. Barking and Dagenham, particular example. How is the system helping you to stay healthy, not to get poorly in the first place, not actually to need medical intervention because you are well? And as a second bit really, which is if by some chance of misfortune you become ill, either physically or mentally, does the system listen to you or does it talk to your mum and dad? How's the system helping you and is it listening to you?
Yes, at the back here.
I'd like to answer the first question. Firstly, we have like community centres where they have like leisure centre and like leisure parks like for young people can go and just play about, and during half terms and holidays we can just go in there, and Lewisham has the swimming pool and it's for free, so you don't necessarily have to pay for it, so it's free. So I think that's helping. So if you can afford it, you can still go because it's free. That's how I think.
And what about a second question? Are you a citizen to the health service?
Yes, in the front though. Anyone want to pick that up? Quite tricky. Kat, I know you've got some thoughts on this because you're in the young person bracket. I mean, you may have some thoughts that you can speak on their behalf because and you I know are very keen on social media in order to help young people gain access to services.
I mean, my experience was I've had mental health problems from about the age of 6.
We may need some a microphone. Or should we turn the microphone round for you? There's a recorder, right? Okay.
So I've had mental health problems.
Make sure that I can hear you however you speak, but can they?
So I've had mental health problems most of my life. I didn't start seeing anyone until I was about 14. Yeah, so that's quite normal, that gap.
I know.
And then after that, when I was 19, as you know, I got involved in Young Minds and spent 5 years volunteering with them. And that was because I didn't feel listened to in primary care or secondary care. And I've spent the last 5 years campaigning to improve things so young people have better experiences than I did.
So I've got a final challenge question and then I will shut up. How are things in every joint strategic needs assessment, every health and wellbeing board plan, every training course for every medical or paramedical professional going to get us to the stage where these are health citizens from a very, very, very young age and we treat them seriously because then they are living a healthy life as well as being ready to be the next generation of health professionals themselves. It's generational, isn't it? And if your commission can get to the stage where it says something generationally driving, then no matter how many times the health service is reorganised, because it's sat down on the same seat for too long, so it needs reorganising all over again. However it's reorganised, the message is out there and in the community.
Yeah. And I think my concern, as yours, and you're sure you share this, is that actually it's not reflected well enough in joint strategic needs assessment at the moment, or it's fragmented, or it doesn't have the kind of profile it should.
Less than a third mention children and young people as a population. They are more numerous than the frail elderly. Sorry.
So, Matthew, yes.
I was just thinking in relation to that, there are two really important themes that come out. One is the theme about health as opposed to reacting to illness. Actually, how do we promote health positively? And taking a developmental perspective, a lifespan perspective, whether it's physical health or mental health, both of these have a lifespan perspective to them and often start in childhood. If we are really to do what's right, then we've got to get upstream and to be thinking about the promotion of health and resilience and building on assets in young people as opposed to the system being predominantly reactive. to things when they go wrong.
So, but my challenge, Matthew, to you, because you said you work and lead the strategic network. For me, Kat will tell you that 1 out of 10 young people don't feel that they're able to cope with life at the moment. So, what can we proactively do that's going to support them and meet their needs? Do you think?
So one of the things that we're doing is around peer mentoring, for example, in adolescence, and that's now a priority from the London Health Board at the GLA, which I think is fantastic. Health professionals like me or you are often not best suited to being the vehicles for supporting young people. Actually, young people are often highly effective at supporting other young people with the right sort of support and training. So that's just an example of the sorts of things that we might think of doing.
Millian, can I bring you in here?
Yes, in terms of young people being healthy in every respect, both mentally and physically, all young people need to play, and many of the opportunities for playing have been removed. There are a number of schools that have opened in the last few years that have no outdoor facilities of any kind that are worthwhile. Many local authorities have cut the funding that they provided for play opportunities during the holidays. There is very little money. There's no commitment currently from the government to ensure that every young person has opportunities to play. The advance of technology has meant that more and more young people are spending more time indoors, when in order to be healthy, resilient, confident young people, they need to be playing outdoors as much as possible. Many of us have argued for the Early Years Foundation stage, which is based on a play curriculum, does still require that every child has access to the outdoors every day, and that's under 5s, but we're talking through all the ages, from under 5s right through to 18, that every young person needs to be out and have spaces to be on their own, to do a whole range of different activities that they determine and not determined by adults. Now, those places are getting fewer and fewer, and we, particularly at London Play, argue for and work with all the local authorities in the best way we can to open up those opportunities. We have currently got funding with other organisations from the Department of Health to open up play streets, to reopen streets to young people, which 100 years ago, maybe a bit less, young people used to play on the streets quite happily, but now we've got cars and a whole range of other problems. But it's vital that young people are able to play outside their own houses, on housing estates, in a local park, but free from any form of concern, and many parents have concerns about letting their young people. One of the, Maggie's talked about the rights of children. One of the rights of the UN Convention on the Rights of the Child is Article 31, which says that every young person has a right to play. And we argue for that consistently, but policymakers don't seem to see that as important. And it doesn't cost anything in terms of what we've been talking about here is, what do you do when things go wrong? And when things go wrong, when young people have mental health problems or physical health problems, it costs a lot of money. What we're saying is, if every young person every day had real opportunities to play with their own, then those health problems would not be so as many as they are. And I think that people think that play, well, every child plays. Every child does not play.
And I think there's a very powerful message emerging here, potentially, for the Commission, actually, isn't there, about ensuring that those places remain secure. I suppose, but Nick, can I bring you in here? Because perhaps, is this an issue of government policy that's allowed erosion of spaces for children to play over the years? And to what extent does the government can we hold you responsible for that, do you think?
Well, I'm an opposition politician, so I'm not responsible for the present government, and I'm not going to certainly be blamed for some of the financial cuts, which have impacted negatively, because they have required local authorities to cut their budgets by very considerable amounts. Our own local authority in Greenwich has had to make £65 million worth of cuts, and inevitably that has negatively impacted on the scope for some of the kind of projects. Now, rather than me pontificate, though, I actually, because we're here to hear about young people, I'd be really interested to listen to the views of the young people from St Matthew's Academy about what they see as the main problems in terms of health for young people in this area, and what would be the most effective answers? What things ought to be done? What are the priorities to really improve health provision and prospects for young people? What do you feel are the priorities?
So questions there to pupils from the Academy again. Anybody like to pick that up? Yes, at the back there.
Promoted enough.
Sorry, not being?
Promoted enough.
Right. So there's an issue about raising awareness of possibilities, is there?
Yeah, because when we're outside of school, there's nothing that's actually wanting to like motivate us to want to do exercise. There's just like we go home, we have to do homework, and then there's nothing to say, oh, you have to exercise, it's important. And then when we're in school as well, when we do PE, sometimes we're not given the options of what we would like to do to make it fun. So it's not really motivating or promoting exercise in like a really good light. So that's what I think.
But you'd welcome the opportunity, would you, to have a broader range of activities outside school?
Yeah.
We used to talk about extended schools, didn't we? I mean, has that concept still faded, or? Yes, please do. Yeah.
I'm actually employed by the school to lead outdoor education. Now, that doesn't happen in every school. There's very few of us across the country, actually. I think there's only about a dozen of us employed in that role.
So this is one of the unique features of the Academy, is it?
And that, because standard PE doesn't work for every child. Not every child is interested in playing football and playing netball, and those standard sort of idea, that standard sort of philosophy behind physical education. My degree was in sport development, so I came from a slightly different direction, but outdoor education enables these children to access physical activity through different ways. Now, we're an all-through school, so by that I mean that we've got children from the age of 3, so early learning, all the way through to age 16. And we have a forest school here at the school, which enables the children to express themselves and actually engage in play without the control of an adult. And that runs all the way through our lower level school. Then feeding through into our secondary, Key Stage 3, Key Stage 4, we have outdoor education, which is where I come in, as well as offering the forest school to the lower levels. That's part of my job. My other part of my job is to get these kids interested in physical activity. Now, we do that in several ways, and it's interesting what you were saying about peer mentoring, is that we do peer mentoring here at the school. That's part of what I offer as the alternative curriculum here. And that not everybody wants to engage in academic the way that all students do as well, so we have to offer a broader spectrum as a curriculum as we can, and we're moving in that direction. But we get kids to do kayaking, climbing, any outdoor activity you want to mention, BMX, a full range of activities that will interest them, and they enjoy those.
Guys.
So what about the competing demands, or not demands, but the competing things like social media, sitting at home on your computers and that kind of thing? Is that an issue? Even if you offer opportunities, actually there are choices that young people make, and how do you encourage?
It's always a distraction because it's part of their life.
Is there anybody in the audience who'd like to pick that question up again? Laptops, etc., are a distraction, and whereby young people could be doing more active things. So, can I take on the front row here, this young lady?
Well, I do taekwondo, an outdoor activity, and I'm quite high up in it. And I decide to practice that. I decide to do that. I don't always sit around on my mobile phone. I know my mum and my dad also encourage me to go out and do stuff. So I don't think social media always distracts everybody, because some people do choose to go out. It's just those lazy people who decide not to do it.
Right. Martin.
I think actually she's just raised a very important point, mum and dad. Actually, children are not just autonomous beings, they have parents. And actually, one of the things we can do to improve the situation for children is actually to improve parenting skills. Yes. I've actually seen the opposite of one of the things that was mentioned. I have seen a young boy having to interpret for his mother in the A&E department because she didn't speak English. A lot of our children in London do have the problem that they have parents who have not themselves got good role models for parenting. And so we have to do quite a lot of work to help people to be good parents. the good parenting that doesn't just say, you know, you do that, but encourages autonomy and resilience. And we're not just seeing that at one social level. I mean, I actually govern 2 schools, an academy in Southwark and a private school, an independent school in the city. And we see similar problems at both ends. We see, in a sense, affluent neglect at one end and actually not knowing what to do at the other end. So we have to do something positive about parenting. And intervention there can actually produce really significant results.
I suppose the challenge is, where does that responsibility lie? I guess it's all of us, but is this something that the school, that extended schools can take on?
Sometimes the schools can actually help there. They recognise that unless you help the parents to be able to help their children, you are fighting a losing battle. You need support at home and at school.
And do the young people here in the front row think that's a valid point, that about encouraging parents to think differently about supporting youngsters? Yeah. So Maggie, can I come back to you again on the issue, because here we're hearing an example of what's an exemplar actually in terms of the nature, the unique nature of the provision. And we struggle with this in health services in terms of translating good practice from one area to another. And we can certainly make some recommendations in the Health Commission report about this, but as Children's Commissioner for England, do you have a role in spreading good practice like this to other schools so they can pick these issues up?
We do indeed. I mean, there are all through schools in other parts of the country, and there are, as you've said, Johnny, a very small number who employ somebody who does your work, but it's a very small number. Yeah. It's just over a year since we published a report called "We Would Like to Make a Change," which was based on what children and young people were saying to us about whether or not they'd ever been truly involved in decision making in the health service, in how services are designed, where you get them, whether they come to you at your youth club or your scout troop or your cadet force, or whether you have to go find them at a clinic, and when you walk through the clinic door and you're watched going in, whether your school nurse comes to find you where you are rather than you having to go into her office, on the door of which it says, "I am the school nurse, are your friends watching?" What they wanted was just a platform to be heard. They wanted to understand how the system works and to help the system to understand what their generation needed from it. So your point about not being listened to until you were 14, if we get it right, and London's Health Commission can be an exemplar for the rest of the country, then actually you will pick things up early so that they're not waiting to be poorly. They're actually dealt with whilst they are just teetering on the brink of not quite being all right, especially in emotional and mental health and well-being, which you're right, 1 in 10 children, young people suffer. So that's 3 in a class of 30. So 3 in your mathematics lesson or your French lesson or your geography lesson of 30 children will be just about coping with getting up and getting themselves to school, but not much else. And there could be all sorts of things going on in their lives. They could themselves be primary carers at home. So it's where the child sits in the holistic picture of what a healthy society actually starts to look like that becomes important. And what we do is use examples of good practice to challenge everybody else, to say, if they can do it here, why can you not do it? Yeah. You know, Greater Manchester involves something like 20,000 children and young people across the boroughs of the Greater Manchester area in working alongside health professionals and local authorities on commissioning strategies for health, which they then co-own. And not only that, they co-inspect and they co-evaluate and they decide on who gets decommissioned because they're not coming up with the goods, and the commissioning cycle starts all over again. Now that's brave stuff, but it's doable.
So we have a lot to learn from Manchester, I suspect, don't we?
Greater Manchester has got some really good practice going on across all sorts of bits of its business. Yes, it does.
Kat, you wanted to come in there. I think Kaz wanted to say something as well. Kat?
I was also going to say, I think especially with mental health, there's just a feeling that you are completely invisible because you don't talk to your peers about it and you don't get a proper reaction from health professionals, and you may not want to talk to your parents, so you do feel completely stuck. And I mean, for me, participation in peer support changed and probably saved my life, and I wish more young people had an opportunity, because we all get branded as apathetic and lazy and things like that. Actually, you know, 76% of all media coverage of young people is negative. we are up against a huge amount, and you know, talking about play, it feels like a lot of joy is being sucked out of childhood, where you've got continual and more intense testing ongoing. I mean, I talk to schools who talk about a known phenomenon called Suicide Sunday, which is the week after exam results come out.
Yep.
You know, if it was any other condition, we would be talking about this and it would be a national scandal. If 3 in every classroom had cancer, we would be talking about this and they would be getting treatment.
Okay, can I pick you up as well, ask you to comment on the social aspects, because some of your support, and I've heard you talk about this very eloquently, is around your development of the Well Happy app, which actually has been a great support to a lot of youngsters, and I'm very keen to actually promulgate that. Could you just give some idea of how that's helped you?
So we developed the Well Happy app because young people wrote an amazing manifesto called the State of Mind Manifesto just for London, and it was about the 10 things they wanted people like you guys to know about. So things like training the people that work with us, like teachers and clinicians, and one of the really important things they said was tell us where to go when we need help. Because actually I think it's kind of cruel that what we do is we say to young people, if you're worried about something, talk to a teacher or a GP, but we don't give teachers or GPs proper mental health training. So young people, if they are brave enough to actually reach out, they're going to potentially the wrong person, or they're going to people that can't help. So I mean, for me, when I was 13 and really struggling, I saw that other people around me were struggling and we had nowhere to go, so I set up a support group online. And 12 years later, I've developed an app that signposts 12 to 25-year-olds to mental health, sexual health, and drug and alcohol services. And, you know, that's me as one person mapping those services and running this project.
But you had to do it, and you had very little support as well. Kaz, you had...
So I just wanted to pick up, because I was aware that we've got another tranche of young people in the room, which are the medical students who very kindly came to support it. And given that you are the people who will be delivering the services in the future, I just wondered what your views were on this. Presumably your medical students in London, and the relevance of your training and also your experience as young people yourselves as to how you felt you might lead services and what services look like in the future.
I think in uni it's really important that we get awareness of what services are out there, because sometimes we don't even know until we start our training of not just the services that are available in hospital, but things that are available in communities as well. So it's really important that we spread the message about what things are available for people when they come to us for help. So firstly, we need to know what is available so that we can pass on the message, and as role models you'd think that that's something really important for us, but sometimes we don't always know. So I think it's really important in our training that it's available for us to know what things are available for people out there.
And any other comments from medical student colleagues? Mary, can I bring you in here, because you've got a programme here which is an educational programme and has obviously engaged the pupils and the medical students very well, and it really is an exemplar, and you've cascaded that out to thousands across London. My next question is, what's next? Have you got any more initiatives that are going to meet this growing need for education? Because I think what we're talking about here is awareness education, awareness raising. Do you have any other plans? Well, clearly it's been very successful what you've done so far.
Yes, it has been very successful, and at the moment we're continuing with recruiting about 100 new schools a year, but obviously there are over 2,200 schools in London. It would take us years to get through that without the amount of funding that we would need to be able to do that. But we would like to be able to see the model replicated in other areas of the UK, for example, because I think it would work. I do think that we often underestimate the capabilities of young people. We're saying that you saw there, these young people are just as capable of using emergency life support skills, saving someone's life as an adult is. And we have loads of examples of case studies where a young person they literally just go, I learnt this at school, and they don't panic, and adults panic around them. So underestimating the capabilities of young people, as we've touched on, and then in terms of other projects and other ideas, I mean, with Ben, your point about having more education on healthy eating, preventing obesity, type 2 diabetes, all these things that are costing a lot of money, is that, again, why aren't we empowering young people to learn these kinds of things at school? I think there was a statistic out recently that said there was 72% of parents felt that the pester power when they're in supermarkets of advertising of junk food, that their parents, you know, and I'm a parent myself, I'm subject to that, so I know the pester power. Why can't we turn that round and say, well, what about 72% of positive pester power? If we're feeding that into schools at that level, and the child is saying, I don't want to have that kind of Coke because I learnt at school that that's got 7 teaspoons of sugar in and I'm only allowed 3. Can I have that? Why, you know, I believe that is a turnaround, and that's where I think there are possibilities in terms of extra schools resources for things about, you know, about that healthy eating and things like that. It is difficult to get into schools. You would imagine that phoning up a school about saving Londoners' lives and saying you can get £2,000 worth of equipment, free equipment, you get all this training, you get all this support, but it still is hard for schools to implement that within their curriculum and their timetable. They're so busy. So there are particular ways that I've learned over the last 7 years of working with Saving Londoners' Lives, of ways to engage schools in a more positive way, and I think that is the key. It's not about just saying, right, we should be doing this in schools. It's like, how are we going to get this into schools so teachers can engage with it and pupils can engage with it?
So there's something about prioritisation of this issue in the school curriculum, you're saying?
Yeah, because also it's going to be, in my opinion, impossible to get things like Saving Londoners' Lives, of healthy eating, things like that on the curriculum. It would potentially take years and years for it to be considered. So why not continue in this partnership project way and go, well, it's not going to be part of the core curriculum, but this is the way we can get it in. If this is how it is, it's so important to help reduce, you know, heighten, get up to Seattle level with their rates of survival of out of hospital cardiac arrest. They've risen from 11% in 2008 to 28%. Last year was 32%, but that's the figure is rising. We need to see that, and we're empowering young people and medical students to do that.
Well, you've raised a very important issue that I wanted to move on to, which was the issue of healthy eating and obesity, because the Commission has focused on this and is thinking of ways that the Mayor can actually use his authority around putting tax on sugary foods, for example, reducing healthy eating in schools, promoting healthy eating in schools. I mean, do you think there are any really tangible things that we could do, we could make recommendations about that would make a difference? Because there's no doubt we have a major health problem with children with obesity who are developing long-term medical conditions as a result of poor diet. A lot of that's parenting as well, but what are the key initiatives that are going to make a difference here?
I think putting the emphasis on parents and teachers to be able to solve that problem. Again, I'm going to go back to empowering the young people to do that, and looking online, I've got examples here of resources that are already online for schools to use. Sugar, you know, should there be a sugar tax, and great questions that they can use in a classroom scenario to engage pupils to think about that. How many schools are using those free resources that are already online? Something like this should say, well, these resources are already here, or developing new resources, and these are the ways that we can engage schools with those possibilities and empowering young people to make those decisions themselves, not saying, yes, ideally we would have that parental, you know, example of resources would be an example letter home to say, look, this is what your child learned at school, this is what to look out for, this is how to read food labels, this is the way that they're, you know, just empowering young people really.
So, Chris, I'd like to bring you in, then I'd like to hear some more from the audience actually about this issue of healthy food, because we've talked about parents supporting this, but it is actually yourselves, it's your lives, it's your weight, your bodies that you've got to look after. So, Chris, what are your observations on this?
So I'll just start something that's very relevant to that, and then come back to what I said, which I think links it together. So the first thing is really big stuff we do, like rules about smoking save many more lives than all the clever stuff we do in the health service with, you know, expensive machines and drugs. So stuff about food and healthy eating and exercise will have a huge impact to populations. The thing I was going to say, which I think leads into that, was I was really struck by some of the stuff that Mary and Ben and Matthew have said. Some of the stuff about Ben talking about ambassadors and Matthew talking about assets, because the kind of people that Mary and Johnny and people have worked with are a huge asset, and we do tend to focus, you know, what we call a health service as an illness service. We wait until people are ill and then patch them up expensively. but we don't, I think, utilise assets, the kind of stuff that CAT has mobilised and so forth, by getting people early. And I can't remember the exact number, but I think you were saying there were 290,000 or something, was it, children that had in some way been exposed to
on the school roll of all our schools. Yeah.
So that's the school roll of the people you've been exposed to. So if, as well as getting people in a place where they can put people right when they've had a cardiac arrest, there's a huge role for those people as ambassadors who can go out and say, do all the kind of stuff about healthy lifestyle and the right kind of eating habits. And a lot of these people can go, to their families and be assets to the community and promote a healthier lifestyle. So we're not so dependent on a very expensive secondary and tertiary care system as we are at the moment. So I think there's a way, of using kind of assets and ambassadors rather than sitting here rather passively waiting for people to come to reach a crisis and then dealing with them in a rather reactive way. And the kind of people in the room are in some ways the kind of foot soldiers of that army. I'd be quite interested to know if in some ways if people are up for it, if people do want to go out and get, promote a lifestyle so that people in their family don't get type 2 diabetes, don't get cancer, become more resilient and don't present with mental health issues, etc.
So what do young people feel about this? What should we do about this problem that we've got? Any thoughts?
I just wanted to say, I think a big aspect of it is education. I mean, for me, I know when I was in school, there was vending machines with chocolates and crisps, and I used to go every day and get a packet of crisps, get a chocolate, because it was there, because it was available. And for me, it was only when I came to university and started learning about this stuff, the effect it has on the body, that I thought, actually, this isn't such a good idea, and I should look at my diet and, eat better foods.
Yes, two of you here.
In school, I remember in primary school, we used, some people came into a classroom to talk about the sex talk and how to not have unprotected sex. They could still do like the same thing with food. They could just come into our class and tell us that this has this amount of sugar and this could affect you in this. When you grow up, this could affect you like this.
And do you think that would have an impact? Do you think that would really make a difference?
Normally, like, when they're always talking to you about how you shouldn't do this, some people don't listen, and some people do listen. And those people who listen are more clever. But even though they do, like, send around chances for live booklets, those booklets about healthy food and things, it would be helpful if they actually do come into the school as well, because it helps, like, other people, because some people don't, it's not everybody that just, like, gets access to everything. So it would be, like, much better if they actually come into school and just talk to us.
Okay. So it's an education thing again, awareness, yes.
I feel that sometimes people don't really understand that they need to eat healthy until something life-threatening happens to them or someone around them. Like before, like for most of my life, I had a really unhealthy diet, but then my auntie had type 2 diabetes, and that kind of made me realize that you need to like fix up your diet, eat healthy and stuff like that. And from then I realized that I can work better in school, I'm more healthy, I can just get up and like run around and not be tired very easily. And I think that people need to like understand that not everything's going to be served for them, that they need to do stuff for themselves. It's like not always something that like something really bad needs to happen in your life that you need to realize that it's time to get up and fix up.
So do you think if your options at lunchtime were a salad and some fruit as opposed to a bowl of chips and ketchup, you'd make the choice? You'd actually accept that? Do you think that would make a difference?
In our school, there are options to do that. It's like we have options.
So you've got the options for chips, have you?
We do. Like we have vegetables with our hot meals, stuff like that. We can pick fruits instead of eating like desserts. We can have water. They give out grapes, fruit salad and that. So it's not like we don't have the option. We do. It's just some people just decide not to.
Right. Yeah. Yes. Well, you look young enough from here.
Thank you. I'm a nurse practitioner in a GP surgery in Lewisham, and I'd just like to say it's really interesting to hear because I really value using visual aids, and the sugar actually showing people visually in a bags of sugar or cubes of sugar, showing people what fat looks like, £2 of fat, and let someone hold, you know, a model of £2 of fat. That works really, really well for not all people, for a majority of people. And I think we're not using our school nurses. We lost our school nurses for many years. We're now getting school nurses back in again. And I think we've got a missed opportunity of using some of our school nurses, not just for them to be knocked on the door to, but actually to come out, and with support from general practice nurses and other allied health professionals, dietitians, to do exactly what you're talking about, to visually show and to have group discussions and bring that as part as your work, your school day, to make that a routine that you're learning about not just sugars but fats and exercise, but make that routine and a normal thing that happens in school.
And that sounds like something the Commission could pick up and make a recommendation on. There's a hand at the back there as well.
Personally, I think we need to make use of the resources that we have around us. Firstly, I'm not saying young people are stupid, but I'm saying a lot of young people are easily deceived and they just want to follow what other people are doing. So, like, if they are going back to the point I think Mr. Smith made, using role models in a society to, you know, advertise healthy lifestyle and how the benefits of it, then young people would, you know, again, follow that, because that's what a lot of us do these days. We tend to follow what other people are doing. So I think we should use the resources and the people we have in the community to boost up and advertise healthy lifestyle.
So something like a healthy living champion in schools, perhaps. They were very, very courteous to Ben there, calling Mr. Smith. You want to respond to that?
I'm sort of interested, you know, again, out to the audience, really, in that, do they have any health role models that they think are already out there that are sort of, for them, showing them the way that they should be? Who are they following? Is there anybody already doing that role?
Who are the healthy lifestyle guides? Are they the footballers of this world, actually, Kaz has just mentioned? Yes, here in the front row.
Not particularly celebrities, but parents and guardians. Like, my mother is a really strict healthy eater. She doesn't drink juice, any sugary drinks, it's straight water. And I think that if people were to encourage parents and guardians and teachers to teach kids to eat healthier, that it would actually help, because she's helped me, so I think it's a good... Sorry?
Thanks.
Yeah, like, I have a big interest in cooking. I'm taking it for GCSE, so yeah.
Behind you there in the second row, one of the medical students again.
From the university point of view, with going back to the student ambassadors, I think there are like groups going up to schools already promoting healthy eating, but it just at a really small scale. It'd be good to, you know, expand on that.
Yeah. Thanks. And at the back again?
Speaking from a young person's point of view, I don't think I would like it if someone just tells me what to do, like, don't eat this, don't eat that. That's why I think the people coming into school, that's why I think that's not working, because I personally feel that they're coming to school and stating to us what to eat and what not to eat. So I think the better way of doing that would be for them coming into school and, again, using what she said, like, basically showing you visually what this is doing to you, how it's damaging your body, and how, like, the benefits of it.
So that's very much as Debbie, which is Debbie, isn't it? That's very much as you were saying, actually give some kind of pictorial representation of what this means. So you have the choice to make. You can either take that and it has an impact on your health, or you can choose not to. But it actually gives you the knowledge of what's in that foodstuff. That's what we're saying, really, I think, isn't it? Victoria?
I don't think that would work.
You don't?
No, I don't think that would work.
Okay. Victoria.
Quickly, over 1,000 schools have signed up to the Mayor's Healthy Schools, which is a sort of collaborative programme, not just on food, but also on healthy schools, anti-bullying and such like. So I think there was a tremendous energy out there. So I think you're absolutely tapping into an open door, I think, judging by the enthusiasm people to hear and what we've been hearing. And so I think if one can continue to raise those sort of, put more effort, I mean, it was a previous system, you know, it happened before, and this has been enlivened, should I say. And it shows there is an appetite out there. So I think it's very good that you've raised this so openly today, because I think there was a lot of good work going on there. As you say, it's a case of bringing it all together and actually raising the profile and perhaps having some good exemplars of healthy schools. Isn't just about food, but it's about the whole holistic approach to how children are happy
Yes.
to actually speak up
Yes.
about the issues that you've raised.
Yeah. Matthew, want to? Yeah.
It's just if we're going to empower young people, then educational settings is the point of universal access, and that the London Health Commission needs to take that on board in terms of where we actually put in support for young people.
Yeah, of course, absolutely. Yeah. Sorry, yes, lady in the purple, is it purple top? Yes, there. Sorry, yourself. Yeah.
So when we started Saving London's Lives, I think one of the best things we did was to think about a great volunteer workforce that was enthusiastic to raise confidence and awareness about cardiac arrest. And I think the medical students are a great role model. I think they're a great set of people because they're young people talking to young people. If I get down on the mat, I'm their grandmother. They don't care what I think. Much more important that they hear from these people that they live a healthy lifestyle, that they're importantly promoting health
So
awareness.
It's virtually a peer support, isn't it, really?
Absolutely, and it's a really great thing, and we've have a lot of enthusiasm amongst medical students who sign into the scheme, who want to get trained in, who want to go out to schools.
Okay.
It's a great collaboration project, just like you said, and we should just make more of it, because there it is in nearly 500 schools with a great reach. It's a fabulous opportunity, and they are wonderful.
So great accolade for the medical students there. Do you want to respond to that? I'm sure you'll feel pleased.
I think I've been to a lot of school sessions before, and one thing that I've noticed is that they don't only want to know about how to do life-saving sort of skills, but they also ask a lot of questions about, what is stroke, what is a heart attack. They want to know what these things are from now because they've seen their families having it. So sometimes it's hard to imagine something that, say, if you eat lots of sugary foods when you're younger, that you could have diabetes in 50 years. It's hard to sort of picture that or visualize it, like you say. So to use visual aids and to explain to people what these things are in simple terms that we sometimes can do is really helpful for people to understand what could happen to them 50 years down the line, for example, if they carry on that way.
And do you feel comfortable carrying out that kind of educational resource that we're talking about? Because obviously you are a great untapped potential here, actually, that we need to take advantage of. There is a young lady at the back, I understand, who I can't see clearly, who's been wanting to ask a question for a while. Is it yourself?
I was just about to say something about an idea that I had, that was, instead of telling people don't eat fatty foods, you should teach them how to cook healthy food. In school we can make our own food, healthy food and stuff like that.
Yeah, absolutely right, Ben.
The positive aspect of it is really, really important. I mean, the media, particularly with the NHS, is always very negative, when in fact the way to get people wanting to be healthy as a society is to go on the positives of what's going on. It really is important.
Can I pose a bit of a challenge there? Because I think there have been two very good examples in the last 15 years. All the focus on healthy eating in schools and the Jamie Oliver and all of that. And one of our local schools across the border in Greenwich, Kidbrooke School, did some fantastic things at that stage to promote healthy eating in school. But in a sense that the momentum has been lost. And the Olympics was seen as a great opportunity to really encourage healthy lifestyles, active participation in sport. And I just get the sense that, people loved it. It was a wonderful summer in 2012. But where has the energy and the enthusiasm gone? Why have we failed to maintain that momentum? What can we do to really use opportunities like that better to get across the message and then maintain the momentum and not allow it to be lost?
I'm going to challenge there a bit. I don't know whether you watched the first international cycling tour for women set off from some place like Oundle yesterday. The Swedish woman who came out with the equivalent of the yellow jersey at the end of yesterday's competition could not believe how many people had turned out to watch them off, cheer them round the route, wait at the end, and so on. And there are legacy issues going on from the Olympics, it seems to me. I live out in South Essex. You can't get onto the car park at the Festival Sporting Village in Basildon, which is one of the biggest sporting complexes I've ever seen. People just go and use it, and it's open till 10 o'clock at night, and they're kicking them out at the end. So, Basildon and South Essex are not the healthiest parts of the world, but it seems to me that there is at least some hope of a legacy. And I guess really, I'm back to challenging you guys. How do you carry the flame? Commonwealth Games is coming to Glasgow. The baton landed back on English shores yesterday. It's really, really important that you pick up those threads, it seems to me, as your generation. It's great to hear that Lewisham Pool is free to your age group. That's not how it works in an awful lot of other parts of the country. How do we use London's capacity to drive and push?
So you're saying the energy is probably still there, that we just need more of a catalyst to actually maintain it going. Yes, what do we think then? Again, the pupils from St Matthew's.
I think that, especially in our school, they do involve us in sports. Like yesterday, I was involved in an athletics competition, and that was involving a lot of schools from the Lewisham Borough. So I think that if they were to do more of that, it would encourage children to enter competitions, to compete, and also to be healthy, to lead a healthy lifestyle.
Good.
I also think it's a very important point, because the thing is, it's not just about helping support and educate the children who are currently children in this room. You are the parents of the next generation and the next generation, and so it's actually about a sustainable understanding of what constitutes staying healthy, the right things to do, etc. as well.
So, I mean, but we're talking about a small bit of it. Unless there are jobs, unless there's affordable housing, unless we get children out of poverty, we're talking about a small part of it. Because it's no good being a healthy person who actually can't get a job. And so we've got to see health, and that's why I'm delighted that health has come back to local authorities, and why actually we managed to talk about health without talking about hospitals or even about doctors. Because actually those things, when we look at the JSNA, we look at all those questions, our open spaces, our playgrounds, the quality of our housing, all of those sorts of things are there. Even, what are our schools like? Now, we happen to be, one of the best of the academies, and many of the academies are like that, but not every school would be able to deliver these sorts of programs. So it's got to, though we're going to have particular focuses, unless we also deal with child poverty and the fact that people are finding it harder and harder to live in central London, then we're pushing the problem outside London into other places.
Well, and also there ought to be many more opportunities to listen to young people that we've had today. Now, how many opportunities do young people really have, and what you were saying, to be heard, to listen to the issues that are important for them, and any strategies that health and wellbeing boards or any strategies that are put together by any local authority or others should involve consulting children first, because children are young people. Sorry, you probably don't want to be called children, but I'm covering the whole age range. They need to be heard, and you said very clearly that they're not. We've heard loads of examples in the newspapers where young people are just not heard. It's like they're invisible. And adults have got to, all adults, not just parents.
Switch into listening mode.
Yes, exactly. Thank you.
Young man on the front row.
Well, basically, what I'm trying to say is that when you're doing health presentations, people mostly say negative things, like if you don't eat healthy, you may get a stroke, this, that, heart attack. Or basically, as a young person, when you're listening to this, you'd be like, so basically, if I eat healthy, what is going to happen? Because basically, what you're trying to say is that if I just eat fast food, this is what's going to happen. I think that they're supposed to include like the positive things, like if you eat healthy, you may live longer,
so make the messaging
you may
positive.
fight cancer and all that.
That's come across very strongly.
But also making the messaging real as well, because I remember being really struck by, talking to young people about stopping smoking. They're not remotely, having cancer or heart disease is never going to happen to them. They're invincible when you're under 21. What actually made much more difference was that it made your breath smell, and would affect your teeth. So if you were going out with someone, that was really unpleasant. That kind of thing is actually, it's finding the things that are really real to people about their health.
Yeah, it's true. But sometimes you have to say the positive things that impact us as young people. Like maybe, as you said, if you smoke, your teeth, like that, it will get people like young people who smoke to stop, like maybe like how the society will accept them, because they won't like it if they go outside and they have yellow teeth or something like that. So what I think should happen is that if adults are giving presentations to us young people about our health and sports, they should mostly involve like positive, realistic things so that we can like associate ourselves
something that young people will buy into.
Yeah.
I'm going to take just one more comment from the floor because we're going to move seamlessly into the next session very shortly, and I've got a couple of questions I'd like to ask the panel before we do that. So one last comment from the young lady at the back.
Personally, I think you have to be real with young people. Like, there's the phrase that we say, selling dreams. Well, the people that are going to come and present to you healthy lifestyle, they need to be able to sell it to you. They need to be realistic as well. They need to be able to like relate to what they're selling to you. Like, I believe in motivation speaking because I can listen to a lot of, like, I don't know, but it needs to be real. Like, the people selling the things to you, they need to be able to connect with it so you can connect with it as well. So there's no point of them telling you, oh, yeah, if you do this, it'll be good for you. Like, for example, smoking kills. But the person that's telling you smoking kills is smoking themselves. That's hypocritical. And a lot of young people don't like
that. So we want better role modelling and less top-down stuff from teachers as well, I think.
Pardon?
Better role modelling, I think, is what you're saying, isn't it?
Yeah.
Good. Okay. Well, thank you very much for that. I'd like to sort of begin to bring this session to a close, but I've got a couple of questions I'd like to ask the panel members. One is to Nick, the other is to Maggie. First of all, to Nick, in terms of the politics of this, because we are going to, if we're going to secure play for children, secure better areas, think about taxing sugary foods, etc., it will require legislation. What are the practicalities of that? And if the Commission recommends it, do you think it's something we'll be able to take it through, because this is a real opportunity to be able to do so? So that's my first question to you, Nick.
Well, I'm going to give two illustrations in response. The first a positive one and the second a relatively negative one. The positive one is that and it's already been mentioned, the introduction of clear bans on smoking in public places has had a huge impact on health. And that was regarded as politically extremely difficult. 20 years ago, people would say, oh, no, you would never do that, it's interfering with people's freedom. But actually, politicians were brave enough in the last Parliament to do it, and it's had an impact, and we've got to remember that. But just as an example of the other side, yesterday in Parliament, I was advocating a procedure to require the installation of smoke alarms in all privately rented properties, because fire kills, and we know that having smoke alarms makes a difference. For people are 4 times more likely to die in a fire if their home is not protected with a smoke alarm. But I got all the old nonsense about regulatory burden, and this is wrong to impose these burdens on landlords. And we've just got to be brave. We've got to fight those kind of pressures against doing things, saying this is an undue restriction on people's liberties, or this is imposing an unreasonable regulatory burden. When it's common sense, when it's clear that there is real advantage in terms of health and people's lives, we've got to be brave about it, and we've got to fight those people, and there will be some who resist.
Good, thank you, Nick. And to Maggie, finally, we've heard a lot today about positive messaging, about the willingness and enthusiasm of young people to take these messages on board and they're framed in the right way. We've heard a lot about the school as the place where this needs to happen, and yet when we talked about introducing these issues into the curriculum, you sat back and you sort of shook your head as if this was an impossible task, but surely there must be something that can be done along those lines.
I'd say it's already in the curriculum. It's already in the personal social health and citizenship education curriculum, which is, however, not a hugely binding statutory requirement on schools anymore, because so much else is. Yeah. And the difficulty, as a former English and drama teacher, the difficulty of cramming everything into the school day and into the school week is recognised by teachers and governors. And as a nation, we need a conversation about what education is for. Absolutely. I talked to a young woman 3 weeks ago who was doing 14 GCSEs. Count them, 14. And you think, why? What on earth do you need 14 GCSEs for? You probably need 8 or 9. And with the rest of your time, you could actually be learning to be a better citizen, a mentor, an anti-bullying ambassador, a CPR ambassador, somebody who peddles the healthy eating message, somebody who mentors younger kids in the junior part of your school to be brilliant in the outdoors and in the forest school. If we want rounded citizens, we need an education that is three-dimensional and rounded, and that's in the United Nations Convention as well. But children only spend 25 hours a week, 39 weeks a year in school, and I'm back with you. This is society. This is every citizen and every parent and every neighbour and every runner of a park and all those people who run those gorgeous squares in the middle of London where you need a key to get in and you can't go out and play. And, you know, this is all of us. These are our next generation, but they're here now.
Yeah.
It's really important that we've had this hour. I found it fascinating and you joined in brilliantly. And I hope we're sending you away with things to think about. And this is therefore also bigger than London. If you can teach the rest of the country, my goodness me, we'll be cooking on gas. And I do wish you well in bringing out the messages that can be driven home.
Good. Well, we're going to have a 5-minute break now. I'd like to thank my guests on the panel here, panel members, but thank all of you because it has been a very rich debate, very useful debate, and I'm sure your thoughts will be reflected in Commission recommendations in the future, and I hope we will make a difference. So thank you all very much. A 5-minute coffee refreshment break, and then we move on, I think. So please, I hope everyone's going to stay for the next session.